Hello everyone, it's me again, Lan-Hsin. I received my membership in feline medicine this year, and I'm currently working in the eastern suburb of Melbourne. I chose a paper looking into chronic kidney disease and an ultrasound index this time. I'm interested in the topic of renal resistive index. I've seen people doing it, but I didn't know what the value meant. Although the sample size was small, hopefully this will give you some new thoughts. Arterial resistive index is a Doppler index. It measures the arterial resistance in the peripheral vessels by calculating the ratio between the peak systolic velocity, PSV, and the end diastolic velocity, EDV, which is independent of the angle and position of the transducer. The index is calculated as PSV minus EDV, then divided by PSV. In the kidneys, renal interlobar or arcuate artery can be used to determine vascular renal resistance. An early renal resistive index increase is associated with a higher vascular resistance, a lower vascular compliance, and renal tissue lesions. The aim of this study was to 1. Investigate in CKD cats the relationships between RI and the following parameters: age, sex, body weight, BUN, potassium, creatinine, IRI staging, USG, urine protein to creatinine ratio, and systolic arterial pressure. And 2. Evaluate the potential use of the RI as a preliminary diagnostic tool for CKD in cats. The study included 24 cats of domestic breeds and both sexes. There were 6 cats in the control group and 18 in the study group. During the ultrasound evaluation, the cats were positioned in lateral recumbency. A multi-frequency probe was used. The Doppler was aligned parallel to the vascular wall and always with an angle of 60 degrees or less. 3 measurements were recorded for each kidney's renal artery, with the mean of all 3 being used for statistical analysis. This is the color Doppler ultrasound image, and the RI measurement was automatically accomplished by the ultrasound station. The table shows the data collected in the study. The RI differed significantly between control group and study group, and the RI values were higher in cats with CKD than in healthy cats. Here we can see that no matter in left or right kidney, the RI values in the study group and in the control group were significantly different. No correlation was achieved between the RI and the studied parameters. However, it was possible to establish a negative correlation with body weight, a moderate correlation with the right kidney, and a strong correlation with the left kidney. The results are summarized here. The RI values were significantly higher in cats with CKD than in healthy cats for both kidneys. A negative correlation with body weight. A strong and positive correlation between the RI values in right kidneys and left kidneys. It was possible to verify a trend that registered higher RI values in cats classified as IRIS stage 4. The study concluded an RI cutoff value of 0.639 for a preliminary diagnosis of CKD for both kidneys, with a sensitivity and specificity values of 100%. In the table, we can see there were 2 CKD cats classified as IRIS stage 2, although we don't know whether they were early stage 2 or late stage 2. The RI value may be sensitive enough to pick up cats with an early stage CKD. The study group cats presented higher RI values than the control cats. This can be explained by the increase in vascular resistance due to the vasoconstriction suffered by the kidney during the injury process at either a glomerular, tubular, interstitial, or vascular level. Diastolic blood flow velocity is decreased at a more superior level than systolic blood flow velocity, thus reflecting a higher decrease of the end diastolic velocity than peak systolic velocity, and therefore increasing the RI value. It was possible to identify a strong and positive correlation between the RI values in right kidney and left kidneys. This may be considered an advantage, particularly in those cases where it is only possible to perform the RI measurement in one kidney. The results suggested that an RI cutoff value of 0.639 for both kidneys is useful in establishing a preliminary diagnosis of CKD when the blood tests, urinalysis, and imaging results are indicating CKD. Another article in the same issue was to compare the ultrasound findings in cats with azotemia versus without azotemia. Ultrasound findings in 238 cats with and 270 cats without azotemia were compared, excluding prerenal azotemia or urethral obstruction. In non-azotemic cats, mean renal length was 40.1 mm. Male cats had larger kidneys than female cats. Mean renal length was 42.1 mm in male cats and 39.3 mm in female cats. On average, right kidneys were slightly larger than left. A significant association between likelihood of abnormal ultrasound findings and increasing age. Abnormal findings included dilated renal pelvis, hyperechoic renal cortex, and calcification of renal parenchyma. In comparison between azotemic and non-azotemic cats, azotemic cats had a significant lower mean body weight and body condition score, and greater mean age and renal pelvic diameter. Based on a reference interval 29 to 51 mm as normal renal length, small kidneys and enlarged kidneys were present in only 16% and 6% cats with azotemia. Renal pelvic diameter was negatively correlated with USG. If the 38 cats with proven urethral obstruction were excluded, the correlation between pelvic diameter and USG was not changed significantly. Ultrasound findings significantly associated with azotemia were perinephric fluid, small kidneys, hyperechoic renal cortex, loss of cortical medullary differentiation, renal calculi, enlarged kidneys, and dilated renal pelvis. In non-azotemic cats, the kidneys were more likely to be recorded as subjectively normal in size in the range 29 to 51 mm, compared to 35 to 45 mm in azotemic cats. If subjective assessment of renal size is prone to bias, the same may be true of other subjective ultrasound findings. Unfortunately, there is no single non-invasive test can provide a definitive diagnosis of CKD in cats. Apart from a preliminary diagnostic tool for CKD, RI may be used for early detection of kidney disease or for monitoring during treatment. I would be interested in looking into the RI changes pre and post ACE inhibitor or angiotensin receptor blocker treatment. I would also be interested in the effect of medication from Japan called Rapros, which is a PGI2 on RI values. Thank you for listening.